Did you know that your risk of a heart attack doubles after the age of 65? But here's the thing. It's not just about age, it's about what's on your plate. Yes, certain everyday foods you probably think are harmless could be silently sabotaging your heart health. As we grow older, our digestive system, metabolism, and even hormone balance change. What was once perfectly healthy might now cause discomfort, interfere with medication, or worsen chronic conditions. In this video, we'll uncover vegetables that seniors should either limit or avoid, and why science backs this surprising shift. 1. Canned corn. Canned corn, while convenient, presents several health concerns for older adults. Its high sodium content can strain aging kidneys and contribute to fluid retention, raising blood pressure and increasing the risk of heart failure and stroke. Research highlights the cardiovascular benefits of reducing sodium, particularly for seniors with hypertension. Additionally, many canned foods are packaged in containers lined with bisphenol A, BPA, a chemical linked to hormone disruption, cognitive decline, and increased risk of metabolic conditions in the elderly. Another issue is the presence of added sugars in some canned corn products, which, combined with corn's natural high glycemic load, can trigger sharp blood sugar spikes, a serious concern for those managing diabetes or insulin resistance. The canning process also compromises fiber quality, reducing its effectiveness in supporting digestion, cholesterol management, and blood sugar control, with studies showing whole food sources of fiber offer greater protective benefits for older adults. Furthermore, canned corn is rich in amylopectin, a rapidly digestible starch that can promote weight gain and fatty liver in seniors with reduced metabolism and muscle mass. Lastly, thermal processing significantly diminishes valuable antioxidants like lutein and zeaxanthin, which are essential for preserving eye health and preventing age-related macular degeneration. To mitigate these risks, choosing low-sodium, BPA-free, and no added sugar options, or opting for frozen or fresh corn, is recommended. 2. Cruciferous vegetables in the elderly. Health risks and cautionary advice. Cruciferous vegetables like broccoli, cabbage, kale, and Brussels sprouts are valued for their dense nutrient profiles, offering fiber, vitamins, antioxidants, and sulfur compounds. However, in older adults, they may pose particular health concerns if not prepared or consumed mindfully. These vegetables contain goitrogens, compounds that can interfere with iodine absorption and impair thyroid function, a significant issue in seniors already prone to hypothyroidism. Additionally, their high raffinose and sulfur content can cause digestive discomfort, such as gas and bloating, due to age-related declines in digestive enzymes and gut microbiota diversity. Cruciferous vegetables also contain phytates and oxalates, which bind to essential minerals like calcium and iron, potentially exacerbating risks of osteoporosis and anemia in the elderly, whose nutrient absorption is often diminished. Furthermore, these vegetables can affect how the body processes certain medications by inducing liver enzymes that speed up drug metabolism, and their high vitamin K content can interfere with blood thinners like warfarin. Lastly, sulfur compounds in these vegetables can produce strong-smelling gas and body odor, particularly in those with compromised detoxification pathways or digestive disorders. To reduce these risks, cooking cruciferous vegetables, introducing them gradually, and pairing them with nutrient-enhancing foods like those rich in vitamin C is advisable, along with careful monitoring of medication interactions and symptom responses. 3. Eggplant. Eggplant, while a source of beneficial antioxidants and fiber, contains a natural compound called solanine, commonly found in nightshade vegetables. In some older adults, particularly those managing arthritis or other chronic inflammatory conditions, solanine may trigger an increase in joint discomfort by promoting inflammatory responses within the body. Research published in Inflammapharmacology, 2010, indicated that solanine could amplify inflammatory markers, potentially intensifying existing symptoms in sensitive individuals. Beyond its chemical profile, eggplant's skin is especially high in cellulose, a form of dietary fiber that can be difficult to digest for seniors with reduced gut motility. As digestion naturally slows with age, excessive intake of this tough fiber may contribute to bloating, abdominal discomfort, or constipation if not properly cooked or consumed in moderation. 4. Onions and garlic. Although raw onions and garlic are frequently recognized for their potent antimicrobial effects and cardiovascular benefits, they can be harsh on the digestive systems of older adults. Both are concentrated sources of fructans, a type of fermentable carbohydrate categorized under FODMAPs, which are known to ferment rapidly in the gut. This fermentation process often leads to increased gas, bloating, and discomfort in individuals with sensitive digestion. Additionally, many seniors experience age-related weakening of the lower esophageal sphincter, LES, a muscular ring that helps prevent acid reflux. Consuming pungent or fermentable foods like raw onions and garlic can exacerbate reflux symptoms by triggering less relaxation. Fortunately, cooking these ingredients can significantly reduce their fructan content, making them less likely to cause gastrointestinal distress while preserving their nutritional value. 5. Artichokes. Artichokes are commonly praised for their high fiber content and rich supply of antioxidants, yet they can pose digestive challenges for older adults, particularly those with sensitive gastrointestinal tracts. A notable concern is their abundance of inulin, a type of fermentable fiber that can be difficult to digest as the gut microbiome changes with age. In individuals with conditions such as irritable bowel syndrome, IBS, or diverticulosis, inulin may ferment excessively, producing gas, bloating, and intestinal cramps. A 2017 study in Nutrients documented how shifts in the composition of the gut flora in elderly populations can impair the digestion of fibers like inulin, increasing the likelihood of discomfort and irregular bowel habits following consumption of high inulin foods such as artichokes. 6. Raw spinach. While spinach is widely recommended for its iron, folate, and antioxidant properties, consuming it raw in large quantities can present specific risks for older adults. Raw spinach contains oxalates, naturally occurring compounds that bind to essential minerals like calcium and iron, limiting their absorption in the intestines. This is particularly concerning for seniors who are already vulnerable to osteoporosis and anemia. Furthermore, oxalates can contribute to the development of kidney stones in individuals predisposed to this condition. The American Journal of Clinical Nutrition has reported that frequent consumption of oxalate-rich foods, like uncooked spinach, can reduce calcium absorption by up to 50%. Fortunately, lightly cooking spinach helps break down oxalates, improving the availability of important minerals and making the vegetable safer for routine consumption among seniors. 7. Legume-based vegetables. Vegetables from the legume family, such as green beans and snap peas, can offer valuable plant-based nutrients but also contain lectins, naturally occurring proteins known for their potential to disrupt gut integrity when consumed in undercooked form. In seniors, whose digestive function often declines with age, lectins can irritate the intestinal lining, impair nutrient absorption, and provoke inflammatory responses, potentially leading to fatigue and gastrointestinal discomfort. A 2015 review in Toxins emphasized that lectins from inadequately cooked legumes can compromise the gut barrier, contributing to increased intestinal permeability, sometimes referred to as leaky gut. Thorough cooking of these vegetables neutralizes lectins and reduces the risk of adverse effects while retaining their beneficial nutrients. A few more to watch. Additional vegetables that warrant caution in older adults include asparagus and beets. Asparagus, though rich in vitamins and fiber, contains purines, compounds that can be metabolized into uric acid. In seniors predisposed to gout, excessive purine intake may trigger painful flare-ups. Beets, meanwhile, are high in both oxalates and potassium. For individuals managing chronic kidney disease, controlling dietary oxalate is essential to reduce the risk of kidney stone formation, while limiting potassium intake is often necessary to maintain heart and kidney health. As a result, these otherwise nutrient-dense vegetables should be enjoyed thoughtfully and, where appropriate, in consultation with a healthcare provider. Final thoughts: aging brings wisdom, but also unique nutritional needs. Some vegetables that once fueled your health might now challenge it. That doesn't mean you need to cut them all out, just prepare them wisely, cook them properly, and watch how your body reacts. Remember, always consult your doctor or nutritionist before making major dietary changes, especially if you have thyroid disorders, kidney disease, or digestive conditions. If this video helps you see vegetables in a new light, hit that like button, subscribe for more science-backed health tips, and don't forget to share it with someone who cares about aging smartly.